More than 50 nursing students gather at Baker's Acres for its annual Farm Safety Day. WIFR reporter Alyssa Kelly talks with experts about educating the future of the health industry on responding to farming accidents.
If I could learn anything with this, I want to learn how to deal with crushing injuries.
Marshall Pack always wanted to be a nurse to make connections and respond to patient needs. He knows so many of those patients will be from rural communities.
Bringing the education to them and the lack there of what they don't know, and when they leave today, they're going to have a lot of knowledge on what goes on in these agricultural traumas.
Mark Baker coordinates the Farm Rescue Program, which he started 35 years ago after seeing too many farming accidents.
The problem with the farm accidents is trauma's trauma, but it's the equipment that causes the trauma.
Students from St. Anthony College of Nursing watched a grain bin rescue simulation, discussed farming accidents, and learn how to stabilize a person hurt in a tractor rollover or whose limb got stuck in equipment.
And we like to prepare the nursing students so what they can expect, like if it's blunt force trauma, penetrating trauma, or crush injury, then that just helps prepare them to take care of that patient a little bit better.
Amber Steinborn is a REACT flight nurse, which she says is vital when treatment is needed fast.
Yeah, I think it's also important for the students to know about rural trauma, because until you work in the industry or especially in transport, you really don't realize how far away resources are.
In Orangeville, Alyssa Kelly, WIFR News.
The training also touched on mental health and the high suicide rate with farmers in the rural community. Farmers have one of the highest suicide rates in the country for job professions.